Do not go to the hospital by yourself. This is coming from an emergency room physician who sees people at their most critical, terrible times of their lives. This is coming from an emergency room physician who has seen some things. And I please, I am asking you, when you go to the hospital, take somebody with you. It doesn't have to be a family member. It can be a friend. It doesn't have to be a friend. It could be an advocate, right? We have doulas if you're pregnant. There's patient care advocates if you are not pregnant. And so there is so much that is wrong with our healthcare system. And we know as individuals of color, right, this video may not be about that, but we know that there are people out there who may treat people differently because of how they look, because of stereotypes that they may have encountered. And so sometimes you need to have somebody who's going to make noise for you. You need to have somebody who's going to be another set of ears to listen and advocate for your needs. I want to tell you a story. So one of the things that I want to tell you a story. So I have a friend. Let me tell you a story. I have a patient who came to the emergency department. She was about 60-something years old. And she came in complaining of a cough, chest pain, shortness of breath. And when she was there, she just kind of reported that she was sick. You know, she's been coughing, sneezing, and really not, doing good. But she said that the symptoms persisted, and as time progressed, she's just not been feeling very good. And, left it at that. And so she got an x-ray, she got some blood work, and then, everything looked good, and she was sent home. Then her daughter called, and her daughter was like, did you know that she had just traveled out the country? She just had COVID. She has a history of cancer. I'm worried about a blood clot. So we had to bring her back to come to the hospital to get a CAT scan to make sure that she did not have a blood clot in her lungs. I bring this up because that woman who came in, she was elderly and didn't really explain the full depth of her history, and we didn't have anything on record. And so she came in and she looked like she was just having a cold. And unfortunately, only after that we had discharged her, when her daughter called back and said, I hope she told you that she has a history of cancer. She recently traveled on a flight. This is her medical history. These are her medications. That changes things. It really changes things. Now, particularly the elderly, we always ask that they go to the hospital with somebody, but I'm also speaking to my young people here. I'm speaking to my moms. I'm speaking to my pregnant moms. You need somebody. You need someone. I remember myself when I was in labor and in pain and on a fentanyl epidural. And when things were going down with my daughter, I felt like I had no voice. I had to call my friend who was waiting in the hospital to come into the hospital to listen to what was going on. She was going back and forth to where my child was, talking to me, keeping me updated, advocating for me, advocating for my daughter. And I will never forget that. And so it is crucial. I'm a whole physician here, and I'm telling you that as a patient, I needed somebody to advocate for me. So what more you? This is what I'm going to have you do. Right now, just pick a point person. If something ever happened to you, who can you call? Who knows you? Right? It could be your spouse. It could be your mom. I want you to pick that person. If you're pregnant, pick that individual who's going to know your medical history. Make sure they know the complications that you've had in your pregnancy. Make sure they know what medical problems that you have. Make sure they know what medications you take. Make sure they know what allergies. Make sure they know what's been going on with you. If you've been suffering with a cold for about 1 week, make sure they're aware. Hey, I've been coughing. I've been having a headache. I haven't been feeling really well. And I think I'm going to go to the hospital to get checked up. Why? Because if you just tell your friend, hey, I'm going to the hospital because, I don't feel good. If something happens to you in the hospital, they have no context. If something happens to you and you end up in the hospital in an ambulance, somebody has to know about what's been going on with you. And so I really think this is important. So pick that person, make sure they know who your doctor is, make sure they know where your doctor works, make sure they know your medical problems, what's been going on with your pregnancy, your medications, your allergies, and make sure that they are not timid. They may need to make some noise. They may need to advocate on your behalf. And so you want to make sure that you get somebody who is okay rattling feathers. Now, of course, being respectful is always good, but you want to make sure that somebody who's going to advocate on your behalf is doing what they need to do. This is really not negotiable. Now, I do understand that there's some people who cannot go to the hospital by themselves because they may be a single parent or they may not have anybody to go with them. And in those cases, I need you to tell somebody where you're going. I need you to go on the phone and let somebody know. Let them know that you're going into the hospital for X, Y, and Z. Get them on speakerphone. Get them on camera. Black women are 3 to 4 times more likely to die from pregnancy-related causes. Black women are more likely to be dismissed. So yes, I'm speaking to you as women of color. This particular video is speaking to you. We don't have the luxury to do this alone. Community is important. A doula is important. An advocate is important. A family member, a spouse. You can't do this alone. You can't. I mean, I never thought that I would need a doula going into labor, but like I said, I had to call my friend. My spouse was as confused as I was. In the emergency situation, my brain didn't function, and he's not medical, so he had no idea what to do for me. So I really, really ask you to do this. If you need help with this and you're in Atlanta, Georgia, particularly if you're a postpartum mom, I want you to give me a call, right? This is what I do. I love to be there and advocate for my moms. I will help advocate for you when you go to the hospital. A lot of times when my moms are having a medical emergency, they get me on the phone. I'm finding out what's going on in the hospital. I'm trying to translate what is going on in the hospital on their behalf. And I am passionate about what I do because I understand that patient outcomes do change, right? Your health changes when somebody's on the other line for you. And that's something that not everybody has a luxury to have. And so if you can't have that personal doctor or a doctor who's available to do that on your behalf, please find somebody. All right, I want you to share this video. I want you to like this video, and I want you to send it to 5 people who need to hear this today. Don't go to the hospital by yourself. Your care changes when you have somebody in your corner. My name is Dr. Choa. I'm a postpartum physician in Atlanta, Georgia. Follow me for more pregnancy or postpartum tips. Take care.